Did you know that there are more bacteria living in your intestines than you have human cells in your body? Maybe even at a 10-to-1 ratio? And did you know that the bacteria that lives in your gut and really all over your body can impact your surgical outcomes? Let's discuss the science. The microbiome has been associated with pretty much every state of health and wellness at this point, from things like depression and cardiovascular disease, risk for cancer, the way that you respond to oncologic treatments, and then the things that make kind of more sense, diseases of the gastrointestinal tract like IBS and Crohn's disease. But the studies now show that your gut microbiome can impact your surgical outcomes. The first thing to discuss is all of the things associated with surgery that can mess up your gut microbiome. It kind of makes sense that antibiotics would destroy your microbiome because they're supposed to kill bacteria. But other things like general anesthesia can actually impact your microbiome. The oxygen that you receive during surgery can impact your microbiome. Decreased sleep, pain medication like opioids, the food choices that you make that probably change around the time of surgery. All of those things negatively impact your microbiome. Now, what studies have shown is that if you take probiotics around the time of surgery, so before surgery and after surgery, it can decrease many complications associated with surgery. Most of these studies have been done for surgeries that somehow touched or involved the gastrointestinal tract, but it's also been shown in non-gastrointestinal surgeries. Some of the complications that probiotics were able to reduce included things like bloating and return of bowel function after surgery, the length of time you spent in the hospital, surgical site infections. All of these things can be impacted by just taking a pill once a day before and after surgery. Now, if you ever go to the health food store and look at different probiotics, they all have different strains and species, and it can be very overwhelming. The reassuring part is that studies have shown that if you just focus on taking 10 billion CFUs, which is the way that probiotics are measured, a day, it really doesn't seem to matter what strain or species. You'll also see all of these fancy probiotics all over Instagram saying, our probiotics are guaranteed to live until they reach the gastrointestinal tract. The studies show it really doesn't matter. None of those studies that looked at outcomes in surgical patients cared whether or not the probiotics made it to the GI tract alive or were neutralized by your stomach acid. So you don't have to worry about that either. Just focus on getting a high quality, third-party validated supplement that is at least 10 billion CFUs, and it's evidence-based to decrease complications after surgery.